It's excellent to have this news from our governor that we'll be able to reopen inter-island travel without quarantine, but we will reassure people that very comprehensive screening will be a part of the plan, so it will be very safe. But the reason the governor was able to make this decision was from the first point, zero new cases. Zero new cases here on June 1st. It's very reassuring to have that number. It's not just a good luck number for us, but it means that there's very little virus floating around right now, so that our inter-island processes, as we refine them, will be perfected before we go to the next step, as the governor pointed out, to Trans-Pacific. Another important thing to note, and I know people lose track of this, is we have not had any fatalities, zero fatalities for 4 weeks. We've had a total of 17 fatalities throughout the total course of COVID-19, but to have zero fatalities for 4 weeks is something exceptional, and we thank our first responders, our medical teams, our nurses and doctors. As Director of Health has pointed out on many occasions, the number of people that have recovered is very significant. We are now at over 95%, it's actually 95.7% of the people that have had COVID-19 in the state of Hawaii have been released. They've recovered. So again, we've done a good job keeping our hospitals available to people, and people have been at home resting, but now they've recovered. So one thing that's very important is we don't want people to be afraid, because as we open up the state, please do expect that there may very well be slight increases in the numbers of individuals that have COVID-19. We've had Memorial Day, we're testing very rigorously now, so those numbers may pop up a little bit, but you should be aware that we have so much capacity in our healthcare system, we have adequate intensive care unit beds, we have ventilators available, that people should not be nervous if the numbers tip up a little bit. Obviously, there are going to be a few more cases once we not only have inter-island travel, but also when mainland travel resumes. So please don't be worried about that. We'll keep monitoring this constantly so that we're safe.
As anybody who has traveled into the state in the last couple months knows, there are already new systems that are in place to keep us safe as people come into our state. Everybody who's had to fly into the state in the last couple months has had to fill out what's called a mandatory travel declaration form. This form has provided important information to our health officials. It has also provided important information to the state of Hawaii designed to keep us safe. As we move towards inter-island travel in the fashion that the governor just discussed, there are going to be new systems in place that people should be prepared to encounter and should be prepared for, and that's part of the reason we now have a couple weeks for everybody to get used to what they might experience. So the first item is there will be a new form. There will be a mandatory State of Hawaii health and travel form. The final version of it is not yet complete, although there are many iterations that are in place. There's been a lot of conversation about it. It is driven by our health needs. It is driven by the fact that there is certain data that the state needs to collect and needs to keep on top of in order to keep everyone safe. So when you come to the airport beginning June 16th, there are new things that you can expect. One will be a temperature screen. Coming in, you will be screened thermally to ensure that you do not have more than 100.4 temperature. After that, the verification of the form that you will have the opportunity to complete before you come to the airport will happen at a checkpoint. The information will include some health information. It will include some information about where you will be staying when you're traveling inter-island, and it will provide again that information that the Department of Health needs to have so that as people start moving in greater volumes throughout our state, we know and have the capacity to do things like contact tracing and to make sure that we have the information we need to monitor the disease as people start traveling more. Once your form is verified, then you will be cross-checked against the travel quarantine database. To be very clear, the travel quarantine for persons coming into our state will remain. So even as we lift the travel quarantine for individuals who are traveling between islands, before anyone does travel, they will be checked against this travel quarantine database. After that is clear, then the person will be free to go through either check-in, as they've done in the past, and then proceed through TSA. So we appreciate that this will be new for a lot of people. We want to make sure that people can start thinking about what it will look like, the time it might take, the kind of information that we'll be asking of, and then there will be more information coming soon about what this form looks like and how you'll be able to access it before you get to the airport.
We're monitoring closely what's happening. Today we had no cases. Yesterday we had one. Day before we had three. We're clearly in a situation where the disease is under control. As the governor pointed out, we have everything in place. We're ready for the travelers who come through. A traveler who's ill obviously should stay home, just as they would from work. There will be a screening process. We will be looking at thermal screening. We're going to be evaluating their health conditions as they come through the system, and we will be testing individuals who show symptoms or signs that would suggest they may have COVID-19. So we have things in place now, I think, that would help to assure that travelers are not presenting an undue risk. Across the state, in every county, the prevalence rates are low, practically zero, which I think is reassuring to most people. So I'm comfortable that as long as people continue to practice what they have been, they're washing their hands regularly, they're wearing face masks when they're near people and enclosed places, that we will be able to manage the cases that occur. There are going to be cases that occur. The governor pointed out we are ready. We have contact tracers on all the islands who can follow up on cases when they do occur. We've got the capacity in our laboratories to handle those. So I think the traveler should be comfortable that as cases occur, and they will, we'll be on it quickly and appropriately. One of the key pieces of information we're going to be gathering through this process is contact information. So if there is a case and we need to identify a person, we'll know exactly where they are and we can contact them quickly and appropriately. So I would say to the traveler, be confident that you have a system in place that will respond quickly, but don't travel if you're sick, and of course, take care of yourself.